Last year, 45% of the U.S. population got their flu vaccine, according to the U.S. Center for Disease Control and Prevention. But what about the other 55%? Did some popular myths keep them from getting a shot? To figure out the fact from fiction, I headed out to the Medical Associates of Central Virginia to learn more. Take a look.
Well, I think the biggest myth is that a lot of people are concerned about it because they're concerned that they may actually get the flu from the vaccine itself. And I think that is the biggest obstacle to people getting the vaccine. They're afraid it's going to make them feel bad, and so they attribute maybe symptoms they've had in the past winter to the flu vaccine, and therefore they don't get the vaccine. And if they don't get the vaccine, then they may end up getting clinical influenza and get quite ill with it.
So, what would you say to those folks? Because there are a few little side effects, right?
There are. With the injectable vaccine, the most common side effect would be some injection site soreness. The majority of people don't have that problem, and if it does occur, it's generally only short-lived. Other people may get a little bit achy, maybe have night sweat, just some really mild symptoms for a couple days, and those symptoms typically will go away thereafter. And generally, if somebody goes home and takes aspirin or Tylenol or aspirin or Advil or Aleve, they're going to be fine.
But if you get the flu itself, right, that can knock you out for like a week.
Right. The flu can make someone very ill. You probably count on being out of work for a week. And then the other problem with influenza is that people can get complications from it. The worst being is that you can get a pneumonia from influenza, which can be very severe, just influenza pneumonia, but then it can lead to bacterial pneumonia. So it can be very, very, very severe, and there are always deaths every year from complications from influenza.
Now, who should be getting the shot and who should not be?
The vaccine now, beginning I think in 2010, when we had an outbreak with pandemic H1N1 influenza, the basically indications were expanded to include everyone that was over 6 months of age. So that's really the only exception. The other exception in the past had been those that were allergic to eggs, but that has changed. Now the guidelines are that if you have only had hives with eggs, that you're not really allergic to them, and you could go ahead and get the vaccine. If you've had more reactions apart from that, then you should direct those questions to your doctor, but there are vaccines out there that are available. Like there's a recombinant vaccine that is totally egg-free. So there are other options out there.
Sounds like it. Lots of options for lots of folks. Now, what about going to a drugstore versus your doctor? What's the better approach to get your shot?
Well, I would recommend going to your primary care physician's office, or if another provider is offering it, that you consider that, because I think you can get patient education there, and if there are questions about previous reactions, then I think those can be kind of incorporated into that discussion and encounter. So I think that really those questions can be directed to your provider since they know your medical history well. And I think probably the best place to get the vaccine is in your own medical office.
And a good thing, too, is that, maybe I have symptoms and I'm not realizing it. You're not going to give me the shot if I have symptoms, right?
If somebody has a very severe acute respiratory illness, then we would not give it, particularly if they have a fever. Now, if somebody's had a cold but they're on the rebound, their fever's gone, then we're going to offer the vaccine to them and tell them they're fine to get it.
And you're doing them a favor because it can actually make their cold worse for a while, right?
Well, if they're really sick with the fever initially, then you may make them feel worse. So we would, in that situation, say come back in a week, get to feeling better, and then we'll reevaluate next week.
I think one thing, too, is that it's nice here at Medical Associates because if folks are walking in the door, if somebody's got some symptoms, they're wearing masks around here. You guys are thinking ahead. You don't want the flu to spread around here, right?
That's correct. That's correct. So anyone that comes in with a respiratory illness here, we're going to encourage them to put a mask on and keep it on while they're in the office. and we're hoping to really cut way down on transmission by doing that.
And if somebody's in a hurry, you know, you've got a big work day, you can still get your flu shot. You don't actually have to see the doctor, right?
That's correct. That's correct. We offer the vaccine every weekday from like 2 to 4 in the afternoon for those that don't have appointments.
And Medical Associates of Central Virginia is having their flu shot clinic Monday through Friday from 2 to 4. They're located on Landover Place in Lynchburg. And if you'd like to become a regular patient, you can always give them a call, 434-947-3944, and find out more online at centralvamd.com.